Hello everyone and welcome to my health talk on hormone balancing. And let me tell you a little bit about myself and how I came about to really feeling convicted to make this information video. I'm in my 50s and I've been a naturopath for a little while, and what began to happen a few years ago is my friends and longtime clients started to come in with different types of diagnoses such as breast cancer, uterine issues, ovarian issues, heart disease, diabetes, and I started to see a pattern occurring in women that were my friends and close to my age, and even many women who were younger, and I could start to see some of these symptoms develop. And as I began to dig deeper, and as I myself began to enter into menopause, I began to see that there was a pattern that occurred early in life that if we were able to interrupt that pattern, then many conditions would perhaps not even develop, or we would be able to dramatically reduce the risk of certain conditions developing. So as a result, I began to really dive into this subject, and what I have learned is there is so much we can do in the natural world of remedies to help our bodies balance their own hormones, and as a result become healthier and minimize the risk of many hormonally related conditions such as breast cancer, uterine cancer, ovarian cancer. Some of the markers that we might be what we call estrogen dominant are many reproductive disorders, and in men, prostate disorders as well. So let's get started and let's get going here. So this video is for educational purposes only. It's not to take the place of your physician. It's not to take the place of your healthcare practitioner. I am going to urge you to work with someone who is well educated on this subject, who understands this subject, and who is committed to getting you to a place where you are stronger, healthier, and have balanced hormones. What I want to talk about is the estrogens in your body, the progesterone, testosterone, DHEA, and cortisol levels. One thing that we need to be aware of is there's something that we call xenoestrogens, and xenoestrogens are chemical components that look like estrogens, and when they get into our body, they begin to command or tell or direct our bodies into doing things such as hormones would do, but the messages that xenoestrogens are sending are incorrect messages that are very harming to our bodies. We get xenoestrogens into our body from the water we drink, from the plastic, especially the plastic water bottles, from non-organic produce which are sprayed with pesticides and herbicides, from cosmetics to personal care products and soaps, which all have chemicals in them or can have chemicals in them. And even some of our supplements can have harming xenoestrogens in them. And this is a very, very, very short list. I mean, we get xenoestrogens just from breathing the air because of the smog content in our air. So recently what I began to see, recently meaning as early as a few years back, is that many of the reproductive conditions and complications were beginning to show up in my office. Prostate issues, breast issue, uterine issues, ovarian issues. Women were entering menopause at an earlier and earlier age. We were seeing an increased number of hair loss and weight gain, skin rashes, fatigues, and people struggling with just brain function. Infertility issues have been on the rise for many years. Girls with PMS And many people believe PMS is normal. It's just part of being a woman. And you know, that is just not true. PMS is not normal. It is a byproduct of not having balanced hormones. Irritability, thyroid problems, adrenal problems, low libido. My teen and children were having adult issues. Some of the ones are listed there. I won't read them, but I mean, they were just all having adult issues. It just didn't seem right. In my studies, as I started to look into what could be causing all of this, what I learned was in 1997 there was a study called the Herman Gibbons study. And basically they took 225 practitioners, and what they did was, as the practitioners would see their pediatric patients, and there was no screening done, these were just patients who were coming in for well care check, they actually were able to analyze data on more than 17,000 girls. These practitioners rated the girls on what we call sexual maturation, and this is how early they begin to develop or enter into puberty. And the ages of these girls were 3 to 12. And the results were that 15% of girls age 8 were experiencing puberty. And that was unusually early. And we call this precocious puberty. 5% of the girls that were age 5 were experiencing precocious puberty. And this was some surprising and alarming information. So the Herman Gibbons study actually found that the African American girls were entering into the precocious puberty at a higher rate than all other races. So they concluded that girls seen in a sample, that the sample of the 17,000 girls in this study across the United States were developing pubertal characteristics at a younger age than currently used norms. And that practitioners are going to need to revise their criteria when dealing with some of these young girls. So what are experts saying as a result of a study like this is that over the course of a decade, the childhood of the U.S. girls have been significantly shortened. We know that early puberty is a known risk factor for breast cancer and other mental health and physical health problems. And we know that exposure to these chemicals that I was speaking of earlier in utero or early in life can lead to low birth weight and obesity, which are of themselves can be a cause of early puberty. So young people being diagnosed with diseases such are being listed here: bipolar, diabetes, depression, hardening of the arteries by age 12, thyroid disorders, sleep disorders, migraines, arthritis, tumors, and cancers. These used to be conditions that I used to see my parents' friends have or my grandparents' friends have. And now I'm seeing younger and younger children with this. So we can't but help ourselves and ask, why is this happening and what is the root cause? What is spurring this on? We also know that cancer has been on the rise, and this is no secret. And every 30 seconds, somebody is diagnosed with cancer in the U.S. More than 1.2 million Americans develop cancer each year. 1 in 3 women in the U.S. will be diagnosed with cancer sometime in her life. And cancer is the primary cause of death in women between age 35 and 74. Lung and prostate cancer are the top cancer killers for men in the United States. So prevention is a better option than early detection. Early detection means you got it. And so what are some of the ways and methods that we can prevent? What are some of the tools that are available to the lay person out there who really wants to be proactive and really wants to minimize the risk of having many of these serious conditions instead of treating them once they get them? So endocrine disruptors, that's what some of these xenoestrogens are. They are endocrine disruptors. Endocrine is the very delicate hormonal system that we have in our body. And these chemicals interfere with that hormonal system in both animals and in humans. What they can do is they can cause cancerous tumors, birth defects, developmental disorders in many of our young people. And ultimately, if this is not corrected, many of these conditions can take our lives. Xeno means foreign. So when we talk about xenoestrogens, these are foreign or strange estrogens that are in our body. They mimic and act like natural estrogens, but they have a different effect than natural estrogens. And this is just one example here. So natural estradiol will increase your sex drive. However, strange or foreign estradiol will decrease your sex drive. And that's just one very simple sample of how it affects our bodies. One of the ways to see if you are estrogen dominant is to have testing done. Now, I will tell you some of the very common symptoms that we see for someone who might be estrogen dominant is either weight gain or inability to lose weight. Weight is seems to collect in the middle part of the body, so it's the stomach, the thighs, the bottom, the hips, and under the arms, under your like in your tricep area. And we know that diabetes and heart disease, stroke, are all connected to estrogen dominance. And female reproductive conditions such as endometriosis, infertility, heavy cycles, PMS, moodiness, tender breast, especially during the time of your cycle, irregular cycles, if you've ever been diagnosed with PCOS, polycystic ovarian syndrome, all of these conditions we know are driven by estrogen dominance. And so what we use in our office is a saliva test. So the saliva test is an at-home test where you get the kit, you take it home, and you collect 4 times during the day. And this here is a sample of the saliva test, of what the whole test looks like. And here on this next screen, we're going to look at the upper half of the test. So here is the upper half of the test. This portion right here is testing your hormones. This section here is testing how your adrenals are functioning. Now, adrenals are very important because when hormonal balance is out of balance in your body, your adrenals can really help to regulate that. And most people don't know how important their adrenals are, and it's important to keep them healthy and strong so they can do the job they were intended to do. So here in the upper left corner, you're going to see there are 4 samples, morning, noon, evening, and night, and that's when the samples are taken. It gives a little bit here about the individual who's submitting the test, and this is, of course, a sample, so this is Amber Sample's test. And here it's going to have the provider's information. Now, this test is available through our office, and at the end of this presentation, I'll tell you how to get it. But what's very unique about this test is that we are looking at different types of estrogens, so E1, E2, E3. E1 and E2, estrone and estradiol, are considered the more aggressive estrogens. E3 is considered the milder of the 3. So it's definitely less aggressive on the body, and it is the estrogen that we want to have more of. Now you can see Amber's test results show that her E1, E2, E3 are all what we call within range. It's the green diamond that we see there. And one would think if your E1, E2, E3 is within range that you are good, you are well balanced. And that's the furthest from the truth. That is not true. What we want to do here is not only do we want to look at whether a person is within range, but we want to look at an equation. So the equation here says E3 must be greater than E1 plus E2. So you would add E1 plus E2, and E3 must be greater than that. And it must be greater than that by 1.5 times. Now for Amber's sample here, E3 is greater by 0.99. So her results are low. This shows that it's low. So she's at risk for having not enough of the milder estrogen and too much of the more aggressive estrogen. This can cause problems in Amber's body. She may already have a multitude of symptoms. Actually, we can see up here that Amber has had a hysterectomy. So that alone already tells me that she must have had some complications in her history, in her health history, to where her physician actually removed her uterus. It could have been a tumor, it could have been a cancer, it could have been heavy bleeding, it could have been a number of things. So that's the first sign something is out of balance. But then there's more for us to look at. So the next thing that we're going to look at is the progesterone level, and that's here, progesterone. So she's at 987. She's within range because here she must be supplementing with progesterone. And so she's great. But there is a ratio, progesterone to E2. You should have at least 200 to 600 times more progesterone than you do of E2. Now, for Amber, she's got too much progesterone. Now, and she's also supplementing. And I know that here because of her higher numbers. I know that's a number for someone who is supplementing. So that needs to be adjusted in her. Her dosage needs to be adjusted. So her testosterone is also high, and her DHT is also high, which is right here. Now, when we see elevated testosterone and elevated DHT in women, we usually see male pattern balding going on. And many of these women usually have sought out help, have tried to get help, but nobody seems to help them, and nobody seems to understand why they are losing their hair. But it's because their hormones are out of balance. So one of the questions that I'd be really curious to ask Amber here would be, are you experiencing hair loss? And she very well may be. And if she's not experiencing it yet, she's at high risk for it, of losing her hair. Now, so that covers the hormonal section. And from looking at this, what our office would do is we would come up with a protocol using primarily Chinese herbs and maybe some mild over-the-counter bioidentical progesterone if she was low, but in this case she's not, to balance out the hormones. Then we would look at the adrenals and the adrenal function. So the first thing is DHEA, which we call the mother of all hormones right here. DHEA can be converted into any one of these hormones up here. So DHEA is low. So this would cause a lot of unwanted symptoms in the body. And she would need to bring that up, which we would work with her on that. And then her cortisol levels. Now you can see they're all green diamonds and they appear to be very well. But I'm going to show you on this next page. This graph, so here is her cortisol level up here. And here is a graph. Now the graph is healthy people, vibrant people, live in this dark green section here, all right? The light green section is acceptable and the blue section is low. Now Amber's has 4 measurements here, morning, noon, evening, and night. And none of them hit the blue section, but you can see, boy, she's right above that blue section, ready to dip down. So we want to see Amber, her results up here in the dark green section, and what we're measuring here is cortisol levels. All right, so cortisol is a form of, it's an anti-inflammatory. Cortisols help to regulate hormones. They help wake you up in the morning. They help put you to sleep at night. There are many, many important functions for cortisol levels, but when we measure cortisol levels, we're looking at how healthy the adrenal glands are. So when cortisol levels are extremely low like this is a very tired adrenal gland. So we would work with Amber to try to get her morning cortisol level up here nice and high. The natural pattern of a cortisol measurement would be the largest dip is from morning to noon, and then a slow decline for the rest of the day. When we look at Amber's pattern, she's almost a flatliner. So that's not a good thing. We need her to wake up feeling refreshed, ready to go. With levels down this low, she probably pushes the snooze button many times. She's a slow morning starter. When she wakes up, the birds are not singing, the sun is not shining, and life isn't great. It takes her a little while to warm up to the fact that she's actually alive and breathing and getting her morning going. I would call a person like this a slow morning starter. But she also has issues as the day progresses. She probably gets very tired somewhere around here, needs a little bit of a pick-me-up, and by the time nighttime arrives, she's done. She's collapsed. She's just like, she's got to find her bedroom, crawl into bed, and close her eyes. Now, we will try to balance this out. And once we did that and her adrenal gland function improved, she would feel a great deal of energy. She'd be more alert. She's able to get out of bed quicker in the morning. And her energy would be sustained throughout the day. So how does a person get a test like this and then get recommendations on what to do? I'm going to show you that next. I want to tell you a little bit about aromatization before I show you the kit that we use to check saliva hormone levels. There's something that every person should know, and it's called hyperaromatization. Hyperaromatization is when we have excess hormones in our body and they convert into dangerous estrogens. So progesterone, testosterone, and DHEA can all convert into these dangerous estrogens through this process of aromatization. So this is something that our office watches for. We watch to see if there is an abnormal conversion of what we call these other hormones, and progesterone is very protective. It's brain protective. It's cell protective. It's known to be a very, very nurturing, beneficial, healing hormone to the body. However, for many people, this progesterone becomes low because it's being converted into harmful estrogens, and that's something that whoever you work with, whatever practitioner you work with, you need to make sure that they are making sure this is not happening to you. So aromatization, you can research that, you can take a look at that. It's very, very prominent with hormone replacement therapy. So many people who are on hormone replacement, a lot of what they're putting on gets converted. And so let's give you the example of testosterone. For men who are using testosterone, testosterone can enter the body through aromatization, be converted into a dangerous estrogen, which causes prostate issues, and they're still low on testosterone because the body is not able to hold that testosterone as testosterone. The same happens with progesterone. The same can happen with any of the other hormones that are used through bioidentical replacement therapy. So this is what the kit looks like. All right, so this is our at-home saliva collection kit. You can either call our office there at that number, or you can go to the website there, type in saliva hormone kit, and it should come up. What you will do is once this kit arrives, it's very clear in its instructions, and you will make note of the time that you collect, and when you have finished collecting the following day, it comes with a pre-addressed label. You will then attach the label and take it to your UPS store or a UPS drop-off somewhere, and you mail it in. The results are sent to our office in about 7 to 10 days, and we will then go over the results with you, making our recommendations, which again are based on many years of experience and helping other people balance their hormones. I will tell you that I love using Chinese herbs. They work very, very well. They don't have any side effects, and I find that they work so much better than bioidentical hormones. That concludes my talk. If you have any questions, please don't hesitate to call our office. And if you suspect you might be estrogen dominant, then let me really encourage you to get tested and get on a protocol to balance out your hormones. I hope this was helpful. I hope that you feel like you've learned a few things, and I look forward to hearing from you guys. Thanks so much. Bye-bye.